Hello, friends and family. Welcome back to Health and Med Made Easy. I am Mariana, your pharmacist guide. Today, we are talking about something that many people struggle with: how to take multiple medications without getting confused. If you or someone you care about takes two, three, or even more medications daily, this episode is for you. We are going to walk through clear, simple strategies to help you stay safe, organized, and stress free. Taking multiple meds can get overwhelming, especially if you have a condition like high blood pressure, diabetes, asthma, or arthritis. You might be taking morning pills, evening pills, some with food, some without, and they may all look alike. The more medications you use, the higher your risk of mistakes. That is why learning how to manage them is so important. Now, let's talk about dangers of mismanaging multiple medications. If medications are not taken properly, here is what could happen. You might double a dose or miss one completely. Some medications might cancel each other out. Others could cause side effects when taken together. You might unknowingly overdose by combining similar ingredients like multiple cold medications with paracetamol. That's why we need a system that makes things easy and clear. So, how would you stay organized and safe? Now, here is how to take multiple medications safely without confusion. These tips work for patients, caregivers, and even busy parents. Now, the first tip: use a pill organizer. These are plastic boxes labeled by day and time, AM, PM, or even four times a day. It helps you clearly see if you've taken a dose or missed it. Choose one that fits your schedule. Fill it every weekend or ask someone to help you. Now, another tip is to create a medication chart or schedule. Use a notebook or print a chart with the medication name, dose, time to take it, instructions like with food or before bed. Stick it somewhere visible like your fridge, bedside, or inside your medication box. Now, another tip is to set reminders. Use alarms on your phone or apps like Medisave or My Therapy. These can help alert you when it's time to take medications. Great for busy adults, elderly people, or those managing memory issues. Another tip is to keep a complete medication list. Write down every medication you use: prescription, over the counter, and herbal. Include the dose, the purpose, who prescribed it. This helps during doctor's visits, emergencies, or hospital stays. Another tip is group medications by time of the day. Instead of sorting by packaging or color, sort your medication by morning, noon, evening, or bedtime. Use smaller zip bags or colorful labels to separate them. Now, another tip is to review medications regularly. Ask your pharmacist or doctor to review your entire list of medication every few months. Sometimes a drug can be stopped or simplified. And the last tip we are going to talk about is understanding the purpose of each medication. Don't just take pills blindly. Know what each one is for. It helps you stay motivated and avoid misuse. Ask questions like, what is this treating? Or what should I expect? Managing multiple medications isn't easy and you don't have to do it alone. Here is when you should ask for help. If instructions are unclear, if you feel dizzy, sleepy, or sick after starting a combo, if you are struggling to keep up, if someone you care for is skipping doses or seem confused, ask your pharmacist for help organizing or ask your doctor to simplify your regimen. Now, extra tips for caregivers and parents. If you are taking care of an elderly parent, child, or partner, here is how you can help. Create a routine. So, meds after brushing teeth or before meal. Use visual aids like stickers or labeled containers. Watch for signs of missed doses or side effects. Keep medications out of reach of children. Managing many medications might feel like a lot, but with the right tools and support, you can take control. Use organizers, set reminders, ask questions, keep everything clear and simple. Thank you so much for joining me on this episode of Health and Meds Made Easy. If you missed episode 3 about common medication mistakes, go check that out. It's packed with real life examples. And in our next episode, we'll be talking about side effects, what every patient should know. Subscribe if you haven't yet and share this video with someone who might need it. Until next time, stay safe and well. Bye bye for now.